Welcome to Community Health Matters. I'm your host, Amy Marsalis. October is Breast Cancer Awareness Month, and we have two guests today to discuss the importance of breast cancer screening as well as early detection and treatment. We'll also learn about an innovative new program to help end violence against women and children. All of that and more coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, welcome to Community Health Matters. I'm Amy Marsalis, and with me today is Davisha Moore, who is with Komen Central, Tennessee. So good to have you here today,
Thank you for having me.
Now, we know it's October is Breast Cancer Awareness Month. And you have a personal story to share about your family and why you got involved with Komen. Why don't we start there? I think that's a good starting point when you share a personal
Certainly.
aspect.
So back in 1992, my grandmother was diagnosed with breast cancer, and I lost her that year. But the thing about her story, she actually found her lump 2 years prior to that, but didn't tell any healthcare provider or our family. So by the time she went in for a routine doctor's appointment, my mother was there. The mass had actually grown outside of her skin, and by that time it had spread all throughout her body, and we lost her. So as I grew up, I've just had that on my mind. What could have been different? She believed breast cancer was a death sentence, and that's not the truth now. And so with education, you know, we can really combat some of those misconceptions. And so as I grew up and got into public health and started working for Susan G. Komen, I keep her on my mind. We joked about me not wearing pink today. Royal blue is my grandmother's favorite color. So, you know.
That's really special. And you have pink lipstick on.
I do have pink on lip.
I hope the camera picks that up because that's in honor of Breast Cancer Awareness Month.
Certainly.
Well, that's neat to know the background on that and how wonderful, you know, what a legacy and what a tribute to your grandmother. Okay, so in your role, you are trying to address the disparities, aren't you, in the diagnosis, in the treatment of breast cancer in certain populations. Expand on that for
Certainly.
us.
So one of my main roles is the community outreach and education portion of our goal at Komen. So I do a lot in planning of community events and making sure that women out there know the signs and symptoms of breast cancer and know the resources that are available to them. And also overseeing our grant making process. We actually give grants to other organizations to make sure that women in our area who don't have financial resources and access to care can get those through programs in the community.
We know that the numbers, 1 in 8 women have a lifetime risk of getting breast cancer, and we know that there are so many good treatments for women if they're diagnosed early, but the screening is really key, and there are again disparities there in women getting to a screening mammogram. And again, why is that? Can you draw attention to those areas?
Sure, and I will say that Komen in September came out with this new big bold goal, and it is to decrease death rates in breast cancer by 50% over the next decade. And we do know that 1/3 of those deaths could be prevented if people just get to screening in a timely manner. So we know that because of lack of access, uninsured women, geographical location, they can't get to screening, so we really try to rural areas. We have one county that we serve, they don't have any places to get a mammogram, so we really look at those issues and try to address those, and again try to connect women with treatment and resources.
Do you think too with older women too, like when you speak about your grandmother and her fear and letting it go longer than maybe she could have or should have to be treated, is that something you run into often with an aging population, more than women your age, for example?
Certainly, there's several things. You know, older populations weren't as educated at younger ages about breast cancer awareness, and there's still the misconception that breast cancer is a death sentence and things like that. So We also have run into issues that some women that are over 60 or 70 years old don't think they should get mammograms anymore because they think they're too old. So we do run into those issues and try to educate around that as well.
Some of the most common fears women have about breast cancer education and screenings, as I read through some of the literature preparing for the show, some of these women, not only they don't have access, but they have no child care either, and that can be a barrier as well.
Certainly. And we always talk about, we've done several focus groups that a lot of women are busy working and doing other things for their family, and they simply can't get away from work to go get a screening. And that is a really big issue, and that's why we support some mobile mammography programs in our area to ensure to kind of combat that barrier as well. So.
How is Komen breaking down some of these barriers? So you do have some of these mobile mammogram units, education. Are you teaching women the signs and symptoms, things to look for in their bodies, and encouraging self-checks?
Certainly. And most women at this point, and we've done so much around awareness, they know about lumps. And even among that, there are still other signs and symptoms that can signal breast cancer. So we go out and try to teach those physical signs and symptoms.
What are a few of those?
So redness and swelling, pain in one spot that won't go away, discharge from the nipple, just to name a few.
So for women who don't have insurance, who don't have access, who don't have resources, what options are there specifically? Is it through Komen that they can find some help?
We are definitely a resource in the community, so anyone needing resources can visit our website or call our office. Some programs that I can mention, the breast and cervical screening program through the State Department of Health is in every local health department. So anyone that's uninsured over the age of 50 needing screening can call their local health department and ask for the breast and cervical screening program. Again, there's a mobile mammography unit that we partner with through St. Thomas that we'd be happy to connect anyone with as well. So.
Davisha, what about women who are afraid of the pain or what they have perceived as pain from a mammogram? I mean, I know from personal experience, I don't know if you've had them yet, but that it's really not painful. To me, it's not. But how can you allay women's fears?
So, and I know that Dr. Lawson will be speaking about this a little later, but one of the things that we always tell women, that slight moment of discomfort is worth so much more than the possibility of being a late detection of breast cancer. So as long as we can find it early, there are better chances that it can be treated and a better survival rate.
That is a great point to stop this segment. Thank you so much, Davisha.
Thank you.
You're doing really good work. Your grandmother would be really proud of you.
Thank you.
Yeah, thank you so much. We'll be back with much more right after this. Continuing our discussion on breast cancer, it being Breast Cancer Awareness Month, Dr. Laura Lawson in the lovely hot pink joins me now. She is the medical director at St. Thomas Health Services Breast Program. Welcome. Glad you could be here today.
Great. Thank you for having me.
Let's talk about the mission of your program that you're the director of at St. Thomas. We talked to Davisha previously about some disparities in care and access to care. Let's talk to you about your mission and how to reduce these deadly cases of breast cancer, the ones that aren't diagnosed early.
All right. Well, as part of that, we wanted to be a leader in breast cancer care and currently have one of the largest breast cancer programs in the state. Actually, about a fourth of all breast cancers diagnosed or treated in the state of Tennessee happen at one of our St. Thomas hospitals. So we've really been able to extend our reach and include as many women as possible in that early diagnosis and treatment. And it was mentioned previously, some places have a lack of access, so we actually have a mobile mammography unit that can go to different counties that they otherwise wouldn't have access. We've paired with a lot of large corporations that will actually just have the bus pull up in their parking lot, and then all those employees can get their mammograms done while they're already there, and then they don't have to worry about transportation and childcare. They can go ahead and get that imaging done, and then all of that comes back to our main breast center.
You mentioned before we started taping about early detection and staging of breast cancer and the importance of getting it early, obviously. Let's talk about that, the staging.
Sure. First of all, I think one of the common misconceptions, and that was touched on earlier as well, is that breast cancer is an awful, horrible death sentence and that there's no way around it. And actually, that is pretty much a 180 from the truth. The vast majority of cases are diagnosed at early stage 0, which is kind of precancer cells, or stage 1. And really for stage 0 and stage 1, the 5-year survival is close to 100%.
Wow.
For stage 2, the 5-year survival is over 90%. And even for stage 3, which is either a bigger tumor or with several lymph nodes involved, 5-year survival is close to 75%. So really, the vast majority of women do well. They have their treatment, and then they go on about their lives.
So there's a lot of hope out there. It's finding it early, and you also said oftentimes the lumps are benign. It's not cancer. What about women having lumpy breasts? That doesn't mean they're going to have breast cancer.
That's right. Especially younger women, I think they aren't aware that normal breast tissue is lumpy and bumpy and rubbery, and so that's just a normal situation. And sometimes I think women are afraid to do a self-exam because they're worried that if they do it, they might find the lump that is the awful thing, and then it's all over. When in actuality, we really just want women to be aware of what's normal for them, and so that if something changes, then they can be aware of it, maybe wait through a menstrual cycle, because oftentimes that has a lot of interaction with the breast tissue, and a lot of things go away after a menstrual cycle. And then if something persists, that's something reasonable then for them to talk to their provider about. They might need to have some imaging done, they might need a referral. And I think part of the other problem is women only hear about breast cancer. So either there's nothing going on or it's breast cancer, but they don't realize that there are lots of benign things that are probably more common. Actually, I mean, the average lump and bump is more likely to be benign than it is cancer.
I know personally, I was called back for a second mammogram once, and of course I was scared to death,
Right.
but it had resolved itself, it went away. So that's a perfect example of a case where it was nothing.
Right.
But it's a little scary for those moments that you're waiting for the next one. What is the age to begin having mammograms, the standard?
Well, that is a source of some debate these days, but at St. Thomas, we're really still encouraging women to start at 40 and then to get one every year. And if a woman has a family history, sometimes they might need to start a little bit earlier than 40. We usually recommend starting about 10 years before the youngest age that a family member was diagnosed. And then we usually will encourage women to keep getting mammograms, because certainly being female and getting older increases your risk. So older women are at increased risk. So those are the very people that we want to get a mammogram, not for them to say, oh, I'm too old, I don't need one. They really need to keep coming. So as long as they are mentally and physically healthy and able to get to the place to have the mammogram, then they probably ought to keep doing it.
If someone has, let's say someone doesn't find a lump, but maybe there's some other change in the breast, can you go over what some of those other symptoms might be, that something's going on?
Sure. Sometimes it's more of a thickening. We see a lot of kind of redness, those sorts of things. When in actuality, it's probably more likely to be a rash than it is anything else, or just some dermatitis, a skin thing more than a breast abnormality. Nipple discharge, that is oftentimes listed as something to be aware of, but the vast majority of those cases are benign as well. So really, it's almost more of just a change from what women normally are seeing and finding. And we'd always rather women come in and have something checked out than be at home worrying about it, because we can usually figure it out pretty quickly and put people's minds at ease so they can go on and do other things and not sit home worrying.
Err on the side of caution.
Exactly.
We know there's a Crucial Catch, a campaign coming up, a program that you are doing with, I believe, with the Titans.
Yes.
Can you talk about that? That's going on this month.
Yes.
In October.
Actually, the ball game on the 16th is the breast cancer awareness game, and the NFL always promotes the wearing of pink with the players, but we do a special event and actually have survivors that have a whole special day. We start out at the Titans practice facility, and then they're brought to the stadium, and they're really treated to a special day. They're down on the field at the beginning of the game, and oftentimes get to meet players and just be part of that whole atmosphere, are recognized as survivors.
Great.
And then we get to stay and cheer on the Titans.
Terrific. Okay. Thank you so much, Dr. Lawson, for all that you do.
Oh, my pleasure.
Yes.
Thank you for having me.
And the event is October 16th, and we will be right back with more after this. And what a pleasure to have the CEO of the YWCA of Nashville, Pat Shea, with us. Pat,
Nice
it's
to
been a
be
while. I
here.
haven't
I
seen you in a
know.
while. Pat's a friend of mine, too. And we want to talk about the Y's primary focus being domestic violence, preventing domestic violence. We know you operate the largest shelter in Tennessee. And you've been helping women and children for a century and families.
Right. Over 100 years.
Over 100 years of
Yes.
doing this work.
I haven't been there that long.
Well, I know.
It feels like it, but it
feels
is over
like
100
it.
years.
Okay, let's talk about this new program, MEND.
MEND.
What is this all about,
So
MEND?
MEND is really two words, men and end together. And because the YW has been in domestic violence for over 40 years, and because we're the largest program in the state of Tennessee, and because half our budget goes to provide women and children with safe space, with housing, with a crisis line, I was sort of thinking, well, how do we end it? I mean, why do we keep building more beds and providing more services? Isn't there a way to stop violence? So about 3 or 4 years ago, we started interviewing and looking at people who study gender violence. There's like Harvard professors and really brilliant men and women around the country. And so I kept hearing the same things. And that was that women advocates and victims and batterers are all involved in this scenario, but most men are sort of left out of the equation. And most men are good men. You know, the majority of men that we know are fabulous. And so let's say 95% of all men are just wonderful role models and wonderful men, but they don't have any call to action. They're not feeling the obligation. I don't even think a lot of them understand how big the problem is. So we started this journey to ask men to join us to end violence against women and girls. So we say the end of violence against women and girls begins with men and boys.
Okay, how do you reach your targeted audience? Because we know they're the good men we know. How do you reach the ones that can spread the word? Who are you targeting?
So we came up with some different channels, and we decided we wanted coaches, which is really the world of athletics, clergy, corporate CEOs, and celebrities. So coaches, and I've learned a lot, coaches, I raised a son. They're the most influential folks in a young man's life.
No kidding.
And I was talking to Sean Henry, the president of the Predators, and he said he remembers every single thing a coach ever told him. So if you could get coaches to understand how locker room behavior and conversations really supports a culture that supports violence, and give him the tools to intervene, that would be really successful. So we've reached out to a lot of coaches in our community, and Dana Ford, who's the head basketball coach for TSU, is a big MEND coach. And he actually role models what we call a healthy relationship with his wife. He talks about that the number one partner in his life is his wife. The most important person is his wife and his daughter and his kids. And he talks to the guys on his team about, you know, you might not ever play professional ball, but you have an opportunity to be a great man. And great men love and respect women. They don't speak about them in a derogatory manner. They don't use women as the butt of their jokes. And they definitely don't think women just exist for their pleasure. So
This is
coaches,
brilliant.
it is
This is
brilliant.
brilliant.
Clergy, obviously, lots of influence. You know, clergy are in front of most men, you know, every week. CEOs and celebrities, we think with those 4 venues we'll hit 95% of all men. And then when you get talking to men, I can sort of tell you their reaction.
That was my next question.
There's a group of guys who go, no way, violence against women is not this bad. So again, I'm going to use Sean Henry. We went to lunch because a friend of his asked him to have lunch with me, and he did not want to have lunch with me. He said he wasn't looking forward to it. He wanted to have it be fast. You know what charities,
Yes.
we're leaders, we kind of ask everybody to lunch. And he sat there and he didn't believe that 1 in 4 women are victims of domestic violence, 1 in 5 women are victims of sexual assault or rape. A girl goes to college, 4-year campus college experience. She has a 1 in 5 chance of being sexually assaulted in her time.
That's astounding to me.
That was, I don't remember it being that way, but it is rough. So one thing I've learned is some men, just when they understand how big the problem is, they're floored and they want to get involved. Because they think about their wives, they think about their daughters, they think about their sisters. And that's what Sean Henry, his favorite people, his wife, his kids, his sister. The other guy that I hadn't expected is the one who is a victim of violence against women. And that's a little more complicated. I'll be sitting in my office talking to an executive, and he'll get up and close the door, and I know he's going to tell me a story of how his mother was beaten by his father, or how his sister went away to college and got raped, or how his daughter had a bad experience with her boyfriend. So a lot of men are really passionate about this issue because of their own personal experience. So between the men who've been victims themselves and the men who just really love women, we get a lot of great guys helping us.
Gee whiz.
I know, it's interesting.
It really is fascinating. So you're getting good responses because you're reaching the right people to spread the word and set examples. We know that in the families where there is violence, a lot of times it's repeated.
It is.
So
if you don't stop it, it stays in your family. So, Dana Ford is an example, the basketball coach. His experience growing up, his father was a batterer, and he said to me, I knew I could either become a batterer, become a victim, ignore it, or stop it. And so he's stopping it, and he's stopping it for his wife, and he's stopping it for his daughter. He's working to change the conversation men and boys have. And boys listen to men, and they listen to coaches. So he's got the right clout. He's got the right power and the right influence.
is this going on nationally, or have we started it just here?
Both. Well, we've started it here, and we're working in public schools. So we've got MEND clubs in 8 public schools this fall. We have coaches that are actually working with us from middle school through college. We have a group of clergy that are meeting on a regular basis. We have great board members at the YWCA. We're best partners are the Nashville Predators and Allstate, and we're working with the Ingram Foundation. So we've got a lot of local great support. But we do hope that it'll become a national campaign. I see a lot that's going on right now, and a whole lot of people are talking about it, but we actually think we have the solution.
Sounds like you are definitely on to something. It really does.
And we try to, when we see men behave the way that we want men to behave, we try to hold it up and put all the media on the good guys that the bad guys get.
Yeah. All right.
How do we make a guy really a rock star because of his behavior?
I love that.
Yeah,
I love that,
because they
Pat.
deserve it. And when you're a role model for good, you should get the same attention.
You should get lots of slaps on the back and more. Thank you so much, Pat.
Oh, it's my
Appreciate it very,
pleasure.
very much. We'll be right back after this. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.